thank you so much for joining this panel today. So to start, can we just do another short round of self-introductions, kind of your name, who you are, how you're connected to the NMOSD or MOGAD realm. You want to start?
Hi, my name is Emily Borghard. I'm social worker here at Columbia Neurology with MS and also with epilepsy, but so I am very much, I'm not medical, but I work very closely with the neurology department to help the patients in terms of getting what they need.
Hi, I'm Lauren Gluck. I'm an MS neuroimmunology specialist at Montefiore up in the Bronx.
Hi, I'm Jiyeon Son. I'm a neuroimmunology fellow physician at Columbia.
Oh, we can't hear you. I don't know if it's...
Okay, apparently I'm having technical difficulties. Story of my life. My name is Pat Melville. I'm a nurse practitioner. I'm at Stony Brook University Medical Center. We're about 40 miles east of here, which is about 3 hours away with New York traffic. We have a large MS center, and we follow probably about 30 or 40 patients with NMOSD and MOGAD.
Great, thank you. So we have a kind of wide range of experiences here. So what are some of the common symptoms or comorbidities that someone might experience with a diagnosis of NMOSD or MOGAD? Are we good with them?
So, sure, you all know this as well, if not probably better than me. Depending on the kind of attacks you've had, that often dictates the symptoms that you continue to have. So people who've had vision loss due to optic neuritis may continue to have low vision. That may not just be blurry vision. That could be difficulty with detecting color, difficulty detecting certain things when there's low contrast. Like if you're on a website and the background is white but the letters are gray, that can be really hard. A lot of people mention that even if their visual acuity or their ability to see a letter improves, they continue to get a glare and this sensation that can be related to some headaches or pain that can be really troubling because the ophthalmologists say everything's fine. And you're like, but it's not fine. When people have had transverse myelitis or spinal cord attacks, that can cause ongoing weakness, numbness, which is the neurologist's least favorite word because it can mean anything. People describe decreased sensation, tingling, burning, electrical, and I know for me as a trained neurologist, I kind of lump that all together in my head as pain, and sometimes I'm not careful and I say, oh, okay, so you're pain, and everyone's very quick to be like, no, I don't have pain, I have this. So it's important to make that distinction, but that's usually where I come from. When people have these continued symptoms, it can develop into stiffness of the muscles. The numbness can lead to trouble walking, even if you don't actually have weakness, even if you go into your doctor and they do all the movement tests and you can do it, but you can't make it happen in real life. And then we talked a bit before, the other patients and clinicians talked a lot before about bladder symptoms. Sometimes you can't hold on to your urine. Sometimes you hold on to all of your urine. Sometimes you don't know that you have to go to the bathroom. And then sometimes that happens with bowel movements. And all of that is very hard to bring up to people because those sorts of functions are some of the most personal. And I think we all get embarrassed to mention them and talk about them and think about them. And then, I go, well, you're not supposed to be embarrassed. We are embarrassed. So it's really helpful when the doctor or NP or PA bring it up because sometimes you don't really want to. And the thing that is maybe even brought up less is sexual dysfunction. And so that's something important to bring up if your clinician hasn't mentioned it first. I think I've talked a lot, so I'll leave it open.
Yeah, I think Dr. Gluck's points all underscore the fact that NMO and MOG is very much a multidisciplinary disease that not only involves neuroimmunologists, but also PM&R, which are rehab physicians, neuro-ophthalmologists, urologists. So it's very much a teamwork as well as social work. I know that at our center, Emily does an amazing job helping out our patients. So I think it's really important to remember that it's very much a multidisciplinary condition and not just neurology.
And
Yeah,
guess
I
what?
agree.
Oh, sorry.
Oh, I'm sorry. Go ahead.
And guess what? If you're not feeling comfortable bringing it up with your neurologist, and maybe it wasn't the moment to be talking about it, talk to your social worker. If in the previous panel, I don't know how many folks, when you talk about having your team, you know, people who support you, make sure that you're working with a social worker, because I am the advocate. And if you're not bringing it up to them and you bring it up to me, then I'm going to advocate and bring it up with them and say, hey, did you know that this has been an ongoing issue for the past 5 weeks? What are we doing about it? So that's one of those things where if you're not, I tell my patients all the time, there's no limit on calls. If you feel like you called too many times, no, you can call me all the time. That's what I'm here for.
I think I was very struck by what the patient panel spoke about. I really enjoyed it very much, by the way. Thank you all for sharing your stories. But I think one of the things that we really strive to do as clinicians is we really want to get to know you. You're not just our patient. We want to find out who you are as a person. And the patients that were up here spoke about that and how meaningful that is for them. We want to know who you are as a wife or a husband, a mother or a father, a worker, whether it be, picking up trash or whether it be, President of the United States, whatever it may be. And I think to tack on to that, one of the most important things is communication. You need to be able to communicate and feel comfortable communicating with your provider, with your medical team, that you're not going to be embarrassed, that you're not going to be brushed off, that you're not going to be, your concerns aren't going to be minimized, and that your provider is going to listen to you, and together you're going to come up with a solution. We want to, and I think I speak for everybody up here, we want to partner with you, and that's a shared partnership. So if you are having symptoms, we don't live with you, so we don't know what kinds of symptoms you're having. We see you for maybe a half hour if we're lucky, depending upon how much time we're allowed to have. We may see you for a half hour every few months. We spoke about bladder symptoms, we spoke about spasticity, we spoke about problems with movement and whatnot. But there's also the invisible symptoms that we may not be aware of. Fatigue is a very big problem that many of you experience, I'm sure. Cognitive dysfunction, very big problem. Mood disorders, whether it be depression or anxiety. And once again, we may not be able to glean that information when you come in for a half-hour visit. But if you hopefully will feel comfortable with us to share that information with us, we can again come up together with a good solution. Because again, we want to partner with you.
Yeah, definitely. And yes, the bladder and bowel issues, I guess, are something that is not talked about societally, and so it's difficult for patients to bring it up in the medical setting. So it's really wonderful to just say it out loud in settings like this as well, so people know, like, oh, they may not put together, there's inflammation in my spinal cord that might lead to, issues going to the bathroom. So are there any kind of recommendations you have for patients in terms of coming to you if they have symptoms that they maybe aren't sure about? Do you recommend people kind of come to an appointment kind of prepared with a list of things, or just come and have a conversation? Do you have any advice that you give to patients about that?
I recently had a fairly unique patient experience for me where someone sent me an electronic medical record message through the portal the day before her appointment, being like, I'm going to forget this tomorrow, but these are the questions I want to talk about at our visit. And I have told all of my patients about that since, because I think that's so smart. Every time we go into a doctor's office, whether it's to deal with a hyper-specific disease like NMOSD and MOGAD, or if you go into your dermatologist with a rash, you go in, you forget everything you needed to say. So if you can make a list on paper, on your phone, If you can, email it the day before or the morning of so you don't forget it. It helps us a lot because I have my pre-populated questions that I always ask, but sometimes it's not quite right to what you need to talk about. And I half joke at the beginning of my visits, we're going to start with my business today, and then we're going to get into your business. My business is, are you due for your next medication dose? Are you up to date with blood tests and testing? And have you seen your ophthalmologist? Okay, now you go. What's up? So having a little bit more guidance is very helpful.
And I also I agree 100%. You know, bring somebody along. Bring along a family member, a friend, you know, and take notes. You know, take notes. And if I am speaking too quickly, or if I do accidentally lapse into medical jargon, you know, put up your hand and say, hey, wait a minute, you got to explain that to me a little bit better. We're happy to do that. I think sometimes we do sort of have our own kind of agenda of what we need to get done, but we're really there for you. And so please, please, please don't ever hesitate. And again, bring somebody along, take notes.
Just as a last thing, and then let's definitely let other people speak. If your family member or friend or something can't come in, if they're working, if they're out of town, often we can just call them on the phone and put them on speaker during the visit. That's totally okay. And that helps having a little bit of accountability, a little bit of someone being like, oh, right, isn't that what your doctor said? So ask us if that's something that's helpful for you.
Just to go off of all of that, again, as the social worker, feel free to reach out. Reach out if you feel like you know, oh, I'm going to forget this, or maybe I should have somebody, but I can't. Nobody's available. It's okay to send me the email and say, you know what, I have an appointment, because I also don't check your chart and see all the appointments. So you send a message to your social work team and say, I have an appointment coming up, and I really need to talk about this, this, and this. I've been falling a lot in the bathtub. I really think I need some grab bars, but I don't know what I should be doing about it. And guess what? Then it gets discussed in your medical appointment, and then they come to me and say, okay, we need to get grab bars. How do we do it? And we make it happen.
Yeah. And do you have any other examples for someone who might not know what a social worker might do in this sort of context of, I'm sure there's many things, you kind of wear a lot of hats, I'm sure, but if you could just give a little summary of that, I think that might be helpful.
Well, as I like to joke, as a social worker, I am a open encyclopedia of knowledge and everything that I do. So whether it's a letter you need, whether it's accommodations that you're looking at for work, for your home, whether it's something like a grab bar for your shower, insurance, if we're trying to get Medicaid, you know, everything from disability to, I mean, across the board. If you're not communicating with the social worker about what's going on, then I can't tell you about all these programs that are out there to help you out, whether it's a support group or even getting you connected, because guess what? You probably qualify for disability, and that's a huge process. You're not going to do that on your own. You're going to do it with the social worker, but you have to communicate it with it.
Yeah, and then relatedly, what sources of support exist kind of just beyond the medical team? We kind of asked this in the patient panel, and then to you all as providers.
Well, I know there's people from all over, but every town, every place has support groups. You're going to find one, I guarantee, because I also have looked them up for patients. And we're always going to find a support group, whether it's national or more local. And there's also going to be resources that, like I said, if we need some funding because you tell me, well, I really need a chair for my shower, but it's not possible. I looked it up, it's too expensive. There are funding programs out there for everything, and especially because there are trials going on, there's research going on for MNOG, all of this is available to you, and we have the ways to tap into it. So just ask.
And the other thing I'll say is the one good thing that came out of COVID, I think of nothing good that came out, but one good thing that came out of COVID is our ability to use Zoom. And so as a result, even if there is a support group that may be too far away for you to travel, you know, a lot of support groups now have online, you can join the group via Zoom meetings. Even we, and I'm sure the doctors here as well, we will do patient visits via telehealth. So for some people it becomes too onerous to travel in for a visit, especially we're going to be coming into the winter weather with snow and et cetera. So that's the one thing that I think came good out of COVID, is that, you know, the availability of these online resources. The one thing I do caution my patients about, be careful where you get your information. You know, there's really good, great resources online, but there's also some stuff that's online that's a little bit shady. So make sure you talk to your provider about resources that they might particularly recommend, because some of the information that you might be reading about may not be so accurate, and may be misinformation and misleading.
Yeah, definitely. And then an example also, as you said, of Zoom is that this is being live streamed, right? This is kind of becoming the norm, which is wonderful for people who might not be able to travel or are all over the world. So, and then we haven't talked much about kind of caregivers. In your experience, or do you have any kind of tips or advice for how to kind of care for the caregiver?
One thing I will say for caregivers, especially because a lot of caregivers do come in when we have when they meet with me, and I know the last panel just talked about this. One step at a time. One step at a time, which also includes the caregiver, which also means that you have to take that moment for yourself. You have to take that self-care, and if that means that, well, for 5 minutes you're gonna go and sit down and, you know, read an art, you know, read some news that you really wanted to, but you just realized you haven't done that in 5 days. The self-care part is key, because if you're not taking care, I tell patients this all the time, if the caregiver is not taking care of themselves, how are they going to take care of you, the patient? So that goes hand in hand.
Yeah, I absolutely agree with that. I see so many wonderful caregivers, family, friends who provide support for our patients, and I think it's so crucial that they also look after their health and their mental health.
Yeah, and back to what I said before about communication, we don't know if your caregiver is getting, reaching the point of you know, that tipping point, so to speak. So communicate with us, let us know. And perhaps it might be something as simple as that we can write a letter and ask the insurance company to provide maybe a home health aide for several hours a day, so that the caregiver might be able to go out and get their nails done, or go shopping, or meet a friend for lunch, or whatever it may be. So communicate, let us know, and we'll try to move heaven and earth to try to make that happen for you.
Yeah, what I often hear is the idea of in an airplane you have to put, if you're with someone, the masks come down, you have to help yourself before you can help someone else, right? And I think that ever since I heard that's been something I reference to people as well. So yeah. So I think we are, I guess, ready to take questions, if that works. Okay. We've got one question back there.
Thank you. Hello, good afternoon. Thank you all for your time. My question is for the social worker. Can you just describe more about the bounds of your work? So like, for example, do you do any work that helps with like working with the city to make more accessible streetways for, you know, any accessible issues that may arise for any potential, you know, people who are experiencing, you know, their diseases? Like, where does your work start and kind of end in terms of advocacy?
Well, let me say personally, as a social worker, I am the advocate. I am your advocate, and there are no limits. And until you bring the issue to me, I can't know if I have to draw a line. But once you bring that issue to me, guess what? I'm going to get on the phone, and I'm going to be talking with the city, and I'm going to file a 311, and I'm going to be talking with those people to let them know that there's an issue with the sidewalk. And I have a patient, for example, that the sidewalk in front of the apartment, they did not have they had a huge indentation, so the chair could not go up the sidewalk. So I was on the phone immediately with the city to say that they were in violation of disability codes. And so until you bring it to me, I won't know about it, and there's no limits.
And I think clinicians want to get involved in advocacy too. So if there's something that you are involved in or care about or have thoughts about, where me with a degree after my name makes a difference in the letter, I am happy to write that letter and either send it or call or email, because even though it should not, sometimes it does. And we want to help advocate. The social workers tend to know a bit more about the logistics of it, but that is absolutely part of my job.
And to go on that, as a social worker, I'm going to reach out to the clinicians and let them know, here's what's going on. There's an issue with the apartment. The elevator doesn't work. The patient is having a really difficult time getting up to the 5th floor, and it really could use a letter stating the diagnosis, 100%, what the symptoms, everything. That would be more than me just advocating for calling the building management, etc.
Any other questions? I see a hand.
Hi. So my question is, I've had NMO for 10 years, and I see my local neurologist, who is wonderful. But as I'm sitting here listening to all of you and thinking of the other physicians who are treating patients with NMO and hearing about all these additional supports, I'm wondering if I have outgrown my neurologist. Listening to you talk about having a social worker in the office as another resource, or having bladder issues or sexual dysfunction, are you able to provide those kind of additional supports in your office? Is it time for me to find a doctor who is more specialized in NMO, since now it is more common than it was 10 years ago?
I think there are two suggestions to be made. One is, if you live in and around New York City, where there is the densest population of neuroimmunology specialists, at this stage of medicine, there is virtually no reason not to see one of us. That being said, say you don't live in New York City, or you just really have a good relationship with your neurologist. I have many patients, and I know at the other centers in the city, where they'll come for a once-a-year check-in. Say, this is what's been going on. I've been dealing with these symptoms. I've been following up with these specialists. This is my treatment plan. Is this the right one for me? Is my care optimized? And then the hyper specialist can say, okay, well, this is what I would do at this point, and then get on the phone with your neurologist after the visit and make sure everything's being done on the ground. So this is what I'll do with people who live several hours away and can't get down to the city for visits every 3 to 6 months. Or people who live farther away. I do something similar when I have patients who go off to college out of state. I'm like, get a local neurologist and we'll just talk, just so you have someone who can see you where you are, and then I can be the overseer of things. Neurology is a small universe. There are not that many of us. There's obviously many fewer neuroimmunologists, but even in neurology, and I think it attracts a type of person who doesn't have a huge ego about them. We are in it for collaboration. Now, and not everyone's different, but if you say this to your neurologist, chances are they're going to be like, oh my God, absolutely, please go and talk to someone else. You have so many things to talk about in a 15-minute, 30-minute visit. I would love for someone else to help me with it. and not take it as an affront, no matter how you intend it, which I will assume is not mean, but we like to collaborate. And I think if you feel uncomfortable, maybe talk to the social worker in the office or talk to the nurse or the MA who rooms you at your next visit. Be like, what do you think they would say if I mention this? But I think that generally people are looking to be helpful.
And just to go off of what you were just saying, in terms of having those two neurologists, you just seeing somebody once. I have a few patients that, you know, once a year they're coming in for the follow-up to see if this is right for them. They're going to tell me, they're going to call me, they're going to tell me they're coming in and that they need a few minutes of my time. Because you don't have to be somebody who's just such on a regular schedule that means that that's the only way to talk to the social worker. No, you're part of the you're working with the neurology team. You can be working with the social worker.
We're good. Okay. Well, thank you all so much for wonderful questions, and thank you so much for answering. This has been wonderful. So, thank you.
Yay.